When you picture a horse, what comes to mind? Probably majesty, grace, incredible power.
Hmm.
But what happens when that power turns aggressive? It's a truly scary thought, really, for anyone who interacts with these magnificent animals.
It really is.
Today, we're putting on our detective hats, so to speak. We're taking a deep dive into your sources on equine aggression.
Yeah,
We're pulling out the most vital information, not just to understand this complex behavior, but to help you truly decipher what your horse might be trying to tell you.
that's our mission, exactly.
Yeah.
We're going to try and unravel the underlying reasons horses act aggressively, what those behaviors actually look like,
Right.
and maybe most importantly, how you can approach and manage them safely and effectively.
Okay.
You'll leave this deep dive, hopefully, well-informed, not just with facts, but with, practical insights and maybe a renewed perspective that could transform your relationship with horses.
Okay, let's unpack this then, because equine aggression isn't just a horse being bad. That's probably the biggest misconception we need to tackle right off the bat.
Absolutely.
What your sources reveal is that it's almost always a signal, a form of communication. And understanding that signal is really the key to unlocking the entire mystery, isn't it?
It really is. It's the foundation.
So, our first clue in this investigation, maybe, is how we define aggression itself. Your sources define aggression in horses as behaviors that do or attempt to do injury to another
Mm.
with the apparent motivation of causing harm. It sounds like a pretty wide spectrum of actions.
It is. And if we expand on that a bit, it's actually part of a larger category called agonistic behaviors.
Agonistic behaviors.
Yeah, this broader category includes not just the direct aggression we think of, but also threats, offensive displays, defensive actions, even submissive gestures.
Ah, okay.
What's truly fascinating here, and this is a critical insight for us, I think, is that aggression is almost never random. It's highly contextual,
Like,
meaning it's influenced by everything from a horse's internal state, how they're feeling physically or emotionally, to external triggers in the environment and even learned experiences.
right.
It's like a puzzle with many pieces. It very rarely just happens out of the blue.
That makes sense. That's why it's so important to recognize the nuances then. We can classify aggression by who it's aimed at, maybe its function or its motivation, whether it's offensive or defensive.
Exactly.
So this isn't just about the obvious biting and kicking, though. Those are certainly part of the high-intensity actions. It's about recognizing the entire communication chain leading up to that.
Indeed. And it's also crucial to understand that aggression, in its sort of raw form, is usually a normal species-typical behavior.
Normal. How so?
Well, think about wild herds. Aggression plays a role in establishing social order, accessing resources, that kind of thing.
Okay, right.
However, it becomes problematic, the kind we're talking about managing, when it's triggered by things like anxiety, fear, or, importantly, underlying medical conditions causing pain.
Pain again.
Yes. Or sometimes, more rarely, by endocrine issues, hormonal imbalances, or central nervous system abnormalities. So this leads us straight to the heart of the matter. What exactly are these triggers that push a horse to this point?
This is where it gets really interesting, I think, based on the sources, because what they highlight is that what often looks like simple grouchiness or, stubbornness is frequently a clear, almost desperate signal.
Hmm.
Let's start with what you mentioned and what seems arguably the most common yet frequently overlooked culprit, pain or discomfort.
Yes, absolutely number one to check.
This is where that profound insight lies. What we often label as a stubborn or mean horse is frequently a horse just silently screaming in physical discomfort.
It's so true.
Recognizing this just shifts our entire approach from discipline to, well, compassionate investigation, doesn't it?
It has to. Think about how you feel with chronic pain.
Exactly. Horses are no different. So musculoskeletal pain, like back pain, lameness, ill-fitting tack, maybe a saddle that pinches constantly or a bridle causing sores.
Or dental problems.
Yeah.
Big one.
Right. Dental problems, arthritis, even simple injuries can make a horse incredibly irritable during handling, riding, or even just being touched in that sore spot.
Yeah.
But it's not just external pain, is it? Your sources mention internal issues like gastric ulcers,
Very common.
hindgut acidosis, that's an imbalance in gut bacteria, right?
Right. Affects digestion and comfort.
Or even chronic colic. These can cause a general grumpiness that escalates to aggression.
Definitely. And then there are the rarer neurological conditions like EPM or EHV1, specific viral infections,
Okay.
or even brain tumors, though much less common, that can alter behavior. Rabies, thankfully extremely rare, can manifest with, violent tendencies.
Yeah. And your sources specifically highlight that this grouchiness or irritability can be directly linked to low or moderate levels of pain.
Correct. It doesn't have to be severe, crippling pain to change behavior.
And chronic vertebral problems, back issues, are often overlooked. It's a powerful reminder to always, always look for the underlying physical cause first.
Absolutely. It's the first thing on our checklist every time. Another significant category we need to investigate is hormonal influences. These are often sex-related.
Okay, like stallions versus mares.
Exactly. For intact males, stallions, they naturally show inner male aggression. That's, competition for mares.
Right.
Territorial aggression, and sometimes aggression towards handlers, especially if they're sexually frustrated or maybe overused for breeding.
And what does that look like?
Oh, it can look like biting, striking out with the front legs, rearing, sometimes mounting behavior directed inappropriately.
Okay.
What's particularly noteworthy from the sources is that some breeding stallions managed in hand, led, not loose, can become aggressive to both the mares and the handlers.
Ah, that's risky.
Very. And even retained testicles in males, where one or both haven't descended properly, can contribute to these aggressive stallion-like behaviors.
Interesting. And what about mares? They have their own hormonal factors, right?
They certainly do. Maternal aggression, for instance, is completely normal. It's protective towards humans or other animals when a foal is newborn, particularly in those crucial first few days.
Understandable.
Then some mares also become irritable or marish during their heat cycles due to hormonal fluctuations. Many horse owners observe this.
Yeah, that's a common term.
And then there's a more unusual but important case. Ovarian tumors, specifically granulosa cell tumors.
Okay, what do those do?
They're a particular type of ovarian tumor that can produce hormones, sometimes testosterone-like hormones, causing stallion-like behaviors in mares.
Like what?
We're talking mounting other mares, making stallion-like vocalizations, herding behavior, and definite aggression.
Wow, in a mare.
Yes. And interestingly, the sources specifically mentioned that Arabian mares are reported to show more aggressive protection of their foals compared to some other breeds.
Huh. Okay, shifting gears a bit. Fear and anxiety. Your sources say these are highly prevalent drivers.
Extremely prevalent. And this is where understanding their fundamental nature as prey animals is just key.
Right, their instinct is flight.
Exactly. Flight first. So when flight isn't an option, when they feel genuinely trapped or cornered,
They might fight.
they may resort to fighting as a defense. This can stem from learned fear,
Yeah.
often resulting from previous negative experiences.
Like bad training.
Abusive training, yeah, or just rough handling, accidents during transport, maybe painful vet procedures in the past. These can all make a horse associate specific situations or even specific people with fear.
That makes sense. They remember.
They absolutely remember.
Mhm.
Phobias too intense, irrational fears of specific objects, sounds, clippers, vets, trailers, those are a factor.
Mm-hmm.
And a lack of proper socialization early on can contribute. Foals not properly socialized with humans, or, crucially, other horses, may develop fear-based aggression because they simply haven't learned appropriate social responses.
They don't know how to react properly.
Exactly. And finally, confinement is a big one. Horses are naturally somewhat claustrophobic. Feeling trapped, whether it's in a small stall or during restraint for a procedure, can powerfully trigger fear aggression.
Yeah, I can see that. They're designed to run, not to fight, so when they can't flee, fight becomes their only perceived option.
Pretty much, yeah. It's a defense mechanism kicking in.
And that defensive mindset actually connects directly to another common driver we see, doesn't it? The instinct to protect what's theirs.
Resource guarding.
Right. Resource guarding and dominance-related aggression. This is when a horse protects, say, food, water, maybe a preferred pasture buddy, or a favorite spot in the shelter from other horses or even people.
And it's particularly common if horses have experienced deprivation in the past, or if they're in groups where resources like hay feeders or water troughs are limited.
Competition.
Exactly. Herd hierarchy is also a natural part of establishing social order within a group. Aggression is used to sort that out initially.
But once it's established,
Once established, high levels of aggression usually settle down, unless, again, resources become scarce or maybe new horses are introduced, disrupting the balance.
okay. And what about redirected aggression? That sounds important.
Very important, especially for handler safety. This occurs when a horse wants to be aggressive towards a primary target, maybe another horse, but is prevented, either physically or psychologically.
Like being held back.
Right, or just feeling unable to confront the main target.
Yeah.
And so they redirect that aggression onto something, or someone else, another animal, or, unfortunately, a person who happens to be nearby.
Ouch. Like being in the wrong place at the wrong time.
Essentially, yes.
Yeah.
You become the outlet for frustration they can't direct elsewhere.
Okay. Then there's another category, and this one seems to point more towards human influence. Learned aggression and mismanagement.
Yes. This is where our actions or inactions can really shape behavior. It often happens through accidental reinforcement.
How does that work?
Well, think about it. If an aggressive display, say, pinning ears and threatening to bite successfully, removes an undesirable stimulus.
Like the handler backing off.
Exactly.
Yeah.
If the handler stops doing something the horse dislikes because of that threat, the horse learns, hey, that worked. So the aggression gets reinforced, and the horse is more likely to repeat it. This is a very common mechanism, especially in aggression directed towards humans.
Because we react to it.
We react, and sometimes we inadvertently reward the very behavior we want to stop. Inconsistent training or unclear boundaries are also major contributors here.
How so?
A lack of clear, consistent expectations can lead a horse to test the limits, sometimes using aggressive behaviors, simply because they haven't been clearly taught what the boundaries are or what's expected.
They're confused about the rules.
Pretty much.
Eh.
And your sources also list several specific risk factors here that fall under mismanagement.
Okay, like what?
Things like inappropriate use of punishment, which we already know often just exacerbates fear, small or poorly designed enclosures that prevent escape or create tension between horses, inadequate feeding sites leading to competition and fighting, indiscriminate hand feeding of treats, which can accidentally teach nipping and pushing it.
Oh, yeah, the mugging for treats.
Exactly.
Oh.
Also, insufficient exercise, which leaves them with pent-up energy and frustration, and foals reared in isolation.
Why isolation?
They might develop inappropriately rough play behaviors directed at people because they lack the normal social skills they would have learned from interacting with other horses, especially their peers.
They don't learn boundaries from other horses?
Correct. They don't learn how to moderate their play or read social cues effectively.
Okay, so we've covered a lot of potential causes. Pain, hormones, fear, resources, learning. What does this all mean for you, the listener, when you're actually observing a horse? How do we decipher their language in the moment?
That's the next crucial step.
Horses communicate so much through body language. Recognizing the signs, even the really subtle ones, is absolutely critical for your safety and, well, for preventing escalation. It's about becoming fluent in horse.
Absolutely. And we can generally categorize these signs into warning displays and active aggression. Understanding the difference allows you to respond appropriately and, ideally, de-escalate a situation before it gets dangerous.
Okay, so let's start with the warnings. Warning signs or threat displays, these are those agonistic behaviors you mentioned earlier, the signals before full-blown aggression.
Exactly. These include the classic ears pinned flat back against the head. That's a pretty universal sign of irritation, anger, or impending aggression.
Everyone knows that one.
Pretty much. You might also see the head lowered and the neck extended, often combined with those pinned ears. That's a direct threat display.
Okay.
There's also snaking, the head or neck. That's a low head posture, extended neck, and a rapid side-to-side weaving movement. You often see that in stallions towards mares, or in horses asserting dominance.
Right. What else?
Other signs include vigorous tail swishing or lashing, not just flicking flies, but really forceful movement. Pawing or stomping the ground can signal frustration or irritation. And sometimes you'll see cow kicking or test kicking, a quick short kick, often sideways or backwards, without full force. It's like a warning shot.
Like back off.
Precisely.
Yeah.
Even rearing can be a display of dominance, frustration, or an attempt to avoid a perceived threat. And pay attention to a hard stare or a fixed gaze with narrowed eyes. That's often the direct challenge.
Intense.
It is. And what's interesting is that your sources also mention the flip side, submissive behaviors, like snapping, which is that jaw waving or teeth clamping movement, sometimes with a slight sucking sound.
Oh, yeah. Young horses do that.
Exactly. Their ears are usually horizontal, maybe slightly back. It's how a subordinate horse, often a younger one, defers to a dominant animal, basically saying, I am no threat, please don't hurt me.
So they're constantly signaling their intent, whether it's aggressive or submissive.
Constantly. Then we move into active aggression. These are the behaviors that are direct attempts to cause injury.
Okay, the really dangerous stuff.
Yes, this includes biting, which can range from quick nips to full, sustained bites capable of causing severe injury. Kicking, of course, using either the forelimbs for striking or the hind limbs. Kicks can be directed forward, backward, or sideways. and they are extremely dangerous, potentially life-threatening.
Absolutely.
Rearing and striking simultaneously, rising up on the hind legs and hitting out with the forelegs, sometimes called boxing. That's another high-intensity aggressive behavior.
Yeah.
Charging, running directly at a person or another horse. And vocalizations like squealing or loud snorting often accompany these aggressive acts.
Okay. And play aggression. Sometimes play looks rough.
It can, yes.
Yeah.
Your sources note that play aggression often includes components like nipping or kicking, but it's typically lower intensity and usually doesn't cause serious harm among, say, unshod horses of similar age and weight playing together. But it can cause serious injury to people, even unintentionally. So you still need to be very careful even during what seems like play, especially with young, energetic horses. Don't become the play target.
Good point. Okay, so if you find yourself dealing with an aggressive horse, the good news, according to your sources, is that management is often possible.
Often, yes.
Yeah.
But it requires a very specific, careful approach.
Right. They emphasize this is a comprehensive process, almost like a multifaceted investigation to crack the case, you could say.
Exactly. And the absolute first step, the most critical one, no exceptions, is to prioritize safety. Always assume an aggressive horse is dangerous until proven otherwise.
Okay, what does that mean practically?
It means ensuring your own handler's safety. Using appropriate protective gear helmet, sturdy boots, maybe gloves, working with experienced individuals if you're not confident, and always having a clear escape route planned when you're handling the horse.
Never get trapped.
Never get tracked. You also need a secure environment, safe fencing, secure stalls, and potentially separation from other horses if the aggression is directed towards them.
Makes sense.
And this is crucial advice that comes through loud and clear in your sources. Avoid punishment or aversive methods.
Why is that so important?
Because they often worsen fear-based aggression. They increase anxiety, they can damage or break the horse-human bond, and they significantly increase the risk of injury to handlers when the horse fights back or reacts defensively.
So punishment backfires?
Usually, yes, especially with fear or pain-driven aggression. The focus instead needs to be on understanding the underlying why and then retraining using positive, non-confrontational methods.
Okay, so safety first, avoid punishment. What's next?
The second critical step, really before you even make a behavioral diagnosis, is a thorough veterinary examination.
Back to the physical causes.
Absolutely paramount. You have to rule out pain, discomfort, or any underlying medical conditions first.
What does that involve?
It includes a complete physical exam, a lameness exam, a detailed dental exam, possibly diagnostic imaging like X-rays or ultrasound. Blood work is often needed, including hormone assays, checking testosterone, estrogen, inhibin levels. It's a hormone related to reproductive function, particularly relevant for mares with stallion-like behavior or potential ovarian tumors. Karyotyping, which is a genetic test, might be done for those mares too.
Okay.
You might also need a gastroscopy to look for ulcers and a neurological exam to rule out CNS issues.
Wow, that's comprehensive.
It needs to be. And all of this medical investigation combines with taking a detailed behavioral history.
Like, when does it happen? Where? What triggers it?
Exactly. When, where triggers, what makes it better or worse, and importantly, what's already been tried and what were the results. And an environmental assessment looking at their living space, turnout time, social group dynamics, diet, consistency of routine.
All the puzzle pieces.
All the puzzle pieces. Video recordings, as you can imagine, can be extremely helpful here to capture the behavior objectively as it happens.
Right, so you can show the vet exactly what you're saying. Okay, so you've done the safety checks, you've done the vet workup. Once that underlying cause is identified, the treatment can be specifically tailored. Right?
Precisely. For pain-induced aggression, well, resolving the pain is, unsurprisingly, the key.
Makes sense.
This might involve pain medication, specific dental care, lameness treatment, ulcer medication, adjusting tack, fit whatever addresses the source of the pain.
And does the aggression just stop then?
Often, what's remarkable is how quickly the aggressive behavior can resolve once the pain is managed. However, sometimes the horse has learned the aggressive behavior worked, even if the pain is gone. So some learning behaviors might still require modification through training.
Ah, okay. It becomes a habit.
It can, but addressing the pain is the critical first step. It truly shifts the perspective from my horse is being mean to my horse was hurting.
Okay. What about for fear and anxiety-induced aggression? That seems common too.
Very common. The strategies here usually involve behavioral modification techniques like desensitization and counter-conditioning.
Desensitization, that's gradual exposure.
Exactly. Gradually exposing the horse to the fear-inducing stimulus, maybe it's clippers, or a needle at such a low level that it doesn't cause a fear response, and then slowly, carefully increasing the intensity over time, always staying below their fear threshold.
Like baby steps.
Very much like baby steps. And then there's counter-conditioning, which actually goes hand in hand. This means pairing that fear-inducing stimulus with something positive.
Like treats.
Treats, praise, a good scratch in a favorite spot, something the horse enjoys. The goal is to change the horse's emotional response to the scary thing from, oh no, fear, to, oh, that thing sometimes predicts good stuff.
Okay, like that needle-shy horse example in the sources.
Right, you might gradually show the needle from afar, reward calmness. Then touch with the cap on, reward calmness. Each step pairs the previously scary thing with positive reinforcement, reshaping the association.
Got it. And environment.
Environmental management is also vital for fearful horses. Creating a predictable, safe, low-stress environment helps reduce overall anxiety levels.
And medication.
In some severe cases, temporary use of anxiolytic medications like acetylpromazine or maybe fluoxetine might be prescribed by a veterinary behaviorist.
Why temporary?
The goal is to make the horse calm enough to be receptive to the behavioral modification training. But your sources are very clear. These medications are not a standalone solution. They don't teach the horse anything.
Right.
And interestingly, some medications, like benzodiazepines, can actually increase aggression in some horses. So it requires very careful veterinary selection and supervision.
Wow, okay. Good to know. What about the hormonal aggression?
For stallions, castration is generally highly effective, especially if it's done before they're about 2 or 3 years old, for reducing that intermale fighting and sexual aggression towards handlers or mares.
So gelding works.
It works very well for those specific behaviors, yes. However, your sources do note that some geldings may retain some stallion-like behaviors.
Even after castration.
Yes. And a significant percentage, the sources mentioned, about 1/3 towards other horses, and maybe 5 to 17% towards people, retain some level of aggression after castration.
So it's not always a 100% fix for all aggression.
Not for all aggression, no. It targets the sexually motivated and intermale stuff primarily. And interestingly, the horse's age at castration and their prior experience don't seem related to how effective it is for reducing those specific aggressive behaviors.
Huh. Okay. And for mares?
For mares with that cyclical, estrus-related aggression, hormone therapy with progestins can sometimes help by suppressing their cycles.
Okay.
And if that rare ovarian tumor, the granulosa cell tumor, is diagnosed,
Surgery.
yes, surgical removal of the affected ovary and ovariectomy is usually curative. It generally resolves the aggression and those stallion-like behaviors pretty effectively.
Okay. Now, what about the resource guarding or dominance aggression? How do you manage that?
Environmental enrichment is often key here. Provide ample space, use multiple feeding stations spread far apart to reduce competition.
So they don't have to fight over hay.
Exactly. Ensure there's sufficient forage available generally. Training and establishing clear boundaries are also essential.
Like leadership.
Consistent positive leadership, yes. Using positive reinforcement. Teaching the horse basic manners, like respecting personal space, yielding to pressure when asked. It's also wise to avoid direct approaches. When a horse is actively guarding a resource, like their feed bin, maybe approach indirectly or wait until they move away.
And treats. You mentioned hand feeding earlier.
Right. With a horse prone to resource guarding or nipping, it's often best to avoid hand-feeding treats initially. If you do use treats, provide them in a bucket or just place them on the ground rather than directly from your hand to prevent that pushiness or nipping.
Good tip. And finally, that learned aggression. The stuff they picked up because it worked.
For that, the main goal is extinction, which basically means ensuring the aggressive behavior is never rewarded again.
Stop the reinforcement.
Exactly. If the aggression, the ear pinning, the threat gets the horse what it wants, whether it's stopping an undesirable task or getting attention or space, it will persist. You have to break that cycle.
And replace it with?
Replace it with positive reinforcement for the desired behaviors, rewarding calm, cooperative responses consistently. Professional help from a qualified, positive reinforcement-based trainer or a certified equine behaviorist is often really necessary for these more complex, ingrained, learned behaviors.
Makes sense. It sounds like fixing these issues requires a lot of consistency.
Absolutely. The success of any treatment plan, regardless of the cause, relies heavily on collaboration, consistency, and patience.
Collaboration between who?
It's truly a team approach. It involves the owner, the veterinarian, the trainer, and potentially a certified equine behaviorist working together.
Everyone on the same page.
Critically important. All handlers must apply the same methods consistently. Inconsistency just confuses the horse and undermines any progress being made. And patience is key. There are usually no quick fixes for complex, aggressive behaviors. It's a journey of understanding and consistent, careful effort.
Yeah, that comes through clearly. And your sources also highlight a range of preventative measures, don't they? Things we can do to try and stop it developing in the first place.
Yes, and these are really fundamental to good horsemanship. Things like avoid inappropriate punishment altogether, rear foals with other horses,
Socialization again.
crucial social learning. Ideally, keep them with their mother for at least 6 months and ensure they have access to other appropriate horses, especially peers, to learn those social skills.
Okay.
Ensure sufficient exercise and opportunities for natural play. Provide adequate space, especially in group housing, so less dominant horses can avoid conflict. And strategically place resources like hay feeders and water troughs to alleviate competition.
Basic needs, really.
They are fundamental to creating a healthy, low-stress environment where aggression is less likely to arise.
So wrapping this all up, what does this deep dive really mean for you, the listener? We've explored how equine aggression isn't just bad behavior.
No.
It's this complex interplay of physical factors, psychological states, learned responses, and environmental influences. It really shifts the focus from blame to understanding, doesn't it?
Exactly. And when we connect all these dots, it empowers you, hopefully, to approach equine aggression not with fear or frustration, but with knowledge and a systematic, compassionate plan.
Yeah.
It underscores that aggression is almost always a symptom, a powerful form of communication, telling us something really important about that horse's well-being in their environment.
Knowing this, knowing its communication, it really raises an important, maybe challenging question for you to consider. Beyond just managing aggression after it appears, what is our full responsibility as humans interacting with horses to proactively foster their emotional and social well-being before problems start? How can we ensure they have the psychological and physical conditions they need to truly thrive and maybe prevent these aggressive behaviors from ever developing in the first place?
That's a powerful thought.
It's a thought-provoking challenge, I think, and one that shifts our focus from just reaction to problems towards building a true, deep partnership based on understanding their needs.